Thank you for tuning into the Sistas Talk Podcast. This is Danniem, and today we have special guests. Please pronounce your name properly for everyone.
Dr. Lulu, the momatrician.
That's what I called you last time. So for you guys.
Yeah. I paid money to trademark. I paid good money to trademark both names.
Really?
So,
okay.
Yeah. They actually my trademarks in the US, of course. There's another Dr. Lulu somewhere else, but I am the one and only in the US.
Yeah, absolutely. Great. So that's a great story going into me asking you, who are you? Tell them a little bit more about where you're from, what you do for a living, and tell me why we met the first time, because you were doing a 30-day challenge, if you can explain to the audience.
No, I was just doing a personal 30-day challenge for myself. I wanted to do 30 podcasts in 30 days. I got to 27. I think I did pretty good because I wanted to talk about just during that COVID-19, when we're in the heat of the quarantine. I don't even know what I talk about in your podcast, but I know generally I talk about just the devastation to teenagers and the need for peer contact, and they don't have that, and then they start cutting, and things go down, and there's domestic abuse, and so it's not. I don't know that it's better now, but maybe it's a little bit better because people are moving around a little bit. I did not know this. But apparently, and I don't know why I didn't know it, but I didn't. Apparently, during holidays and during, holidays specifically is what shocked me. There's a rise in domestic violence and domestic abuse. I did not know that. So, of course, when we had the quarantine and everybody's at home and they opened the liquor stores, because America is so smart, liquor stores were open and people were losing their jobs and getting frustrated, but liquor stores were open.
Yeah.
So that's a very bad combination. And that's what happened. Lots of domestic.
And also to add to what Dr. Lulu is saying, not everyone is alcoholic. Some people are naturally, they have this adrenaline and rage inside of them because they're not getting the counseling and help that they need. You and I talked about on our previous podcast months ago, parenting, teenage abuse, bullying, and things like that. So definitely you are in alignment with what you just said you did for the 30-day challenge. Congratulations for completing 27 podcasts, by the way. That's a huge accomplishment. That's a huge accomplishment.
I think also the quarantine helped. Everyone was home and everybody has a podcast right now. As a matter of fact, I was just telling my spouse the other day, I think my son too, I looked at one of my mentors in the podcasting world. She actually showed me the ropes and she celebrated 5,700 downloads last week.
Wow. Yeah.
Like, oh my God.
That's cool.
I said, I hit 7,000 2 months ago. So I'm like, geez, so I was happy for her. Don't get me wrong. But I was like, oh my God. So I think it just depends on the message in your podcast. And if your message is, if it's the time for your message, it's the time for your message.
Good segue into what I wanted to talk about. For most people who have been following the Sistas Talk Podcast, we are definitely an organization that works towards removing the stigma of counseling. And then this podcast is an extension of Sistas Talk LLC, which we focus on educating the community about opportunities, small businesses like your own that are out there in the community actually supporting and helping the people who need the help. So today's segment, we wanted to talk about depression. It's kind of an extension of what you just mentioned earlier about domestic violence. A lot of people, it's kind of all in the same bowl in a sense. I know it's not the same exact thing, but a lot of times, men and women, they become depressed as a result of being in abusive relationships. They become depressed based upon traumatic events in their life. And I want to ask you, do you know someone personally, or have you experienced depression in any type of way? And what did you do to succumb that feeling, that experience that you were going through?
I don't think I had depression. I think I had a depressive crisis. As a matter of fact, in my TEDx talk, that's what I'm talking about. I'm talking about the fact that it's mental anguish and not mental illness that causes people to dwindle all the way down to the suicide path. Why do I say that? What you just said. People are home, they're losing their jobs, they're losing their source of livelihood, they're losing their family members, okay? The family members who are dying, you can't even go to the hospital to say goodbye. Or they come home and they're quarantined and then they die in the basement, which I know someone who did that. So when I was suicidal only because I had just been divorced. And as a single mother of 3 in America that have no family members, none. I was by myself and my 3 boys, and then we were 100% ostracized by that side of the family. So I found myself like, and then what happens when you get in that situation? You start auto-destructing. You start telling yourself, you're not good enough. You're stupid.
Right.
How dare you do that? Why did you even, he beat you up, but did he really kill you? It's like you start justifying stuff that's like, doesn't make sense. And before you know, you're like, you know what? You're not even worth it. And once you start saying you're not worth it, you're not good enough, and you start to believe it. So that's why I say about people that talk about affirmation. And while I'm pro affirmations all day, I am also more so pro you believing what you're saying. And so my favorite quote is, if you can believe it, you can be it. You can say it all you want. I is good, I is pretty. Yeah, but do you believe that you're pretty?
Right.
Because the next minute you say, people, and I use that as an example when people say, I say, you've got a beautiful, Danielle, I love that, I don't know, that pattern on your shirt, or that you have a beautiful hair or something, whatever. And then the first thing you say, oh, this old thing. No, just say, thank you so much.
Exactly.
But we don't do that because we want to diminish self. And the body language also shows, look at how you're sitting like this. But you know about the power woman, the superwoman pose. If you actually do the superwoman pose, you feel better. Like you don't even know why, but you feel better. And so I am pro therapy, I'm pro counseling, all actually anti-medication, believe it or not. I think I'm one of the few doctors that I know. Yeah. Because I know what you said most times is something that happened. And so don't give me fish. Teach me to fish.
Yes.
Don't give me bread. Teach me to bake. Why do I say this? Band-aid, medication is a Band-Aid.
Right.
It's a Band-Aid.
It's a patch.
Yes, exactly. It's a patch. It's like, well, we just put this and then you come back next week. So there are obviously there are many layers of it. But when somebody is depressed, there can be genetic, yes, it can pass down from your mother if your parents are depressed and all that. But that ability to say for 30 years you've been taking your antidepressants, you haven't gotten better yet, what's going on?
Right.
You have not looked into what caused you to get there in the first place, or what is around you that is feeding that.
So environmental stresses?
Yes, codependencies, baby. All of those things that feed that. Enablers. I have a patient who, she has attempted suicide 3 times. She's been in the hospital for attempted suicide twice. She's been getting therapy for 2 years. Do you know how many times she saw me?
Many times, I'm sure. Oh, once. Wow.
One time, and the next time I saw her, her hair was did. She had makeup on. She sent me a text that said, I have cleaned up my room. She said, I'm taking care of my goals. I can't find, I don't want to show it on my phone.
Yeah.
Because you will see, but she said that, she said, I just want you to know that I've cleaned up my room. I am knocking out my goals. Something like that. That was all she said. What was the difference between 2 years of trying to kill herself? What I did was I said, everybody who's around you must be part of the treatment. It's not just fix the child and then put them back in the toxic.
Correct. Yes.
That's not going to work. Yeah.
Right.
So besides that, I also challenged her. I challenged her to do better by herself, for herself. Like, oh, I'm sad. Oh, you're sad. What caused you to be sad? Like we talked about, for instance, the last time she cut, I made sure I said, I want us to go back to the last time you cut. What happened? And then she drew the story for me. I mean, it was something maybe not big for you and I, but for her, it was huge. Yeah. Her mother cooked something that she doesn't like. And because her mother, she's 16, she's 13, her mother cooked something that she doesn't like. And she said, I've told my mother that I don't like it. And so she said, I don't feel seen and I don't feel heard, right? Good point. But I challenged, I said, wait, you're 13. Can you cook?
Right.
Because you see, my son, and I'm not trying to brag, please, this is the kind of practice I have. I make them, I say, what do you want to talk about today? There's no form. Everything is organic. I said, can you cook? She said, no, not really. I don't like the stove. I said, you don't like the stove, but you can eat?
But you want to eat, yeah.
So now we talked about the fact that if you go shopping with your mother, you have a higher chance of saying, Ma, I don't really like that. Can we have this?
Mm-hmm,
And then when you
mm-hmm.
come home with that which you like, you can help make it.
Yes.
And you see, when you have dinner, and then you won't have to feel unheard, feel unseen, cut. You see the difference?
Dr. Lulu, you're making people think. That's what you're doing.
That's what I'm here for.
You're just teaching them to do forward thought.
Yes,
That's it.
You know what they say? They say there's two most important days in your life. The day you were born and the day you figured why you were born. I was born for this. Like, seriously, of all the 17 patients that have passed through my practice, because my practice is very small and very unique, none of them is on medication. All of them were suicidal before they met me.
Wow.
None of them has died by suicide, because what I do is I challenge them. The last time one of my patients called me, she said, oh, I'm so depressed. I can't wait to see you. You know what I said? I said, before you come see me on Tuesday, I want you to call 5 of your friends and tell them Dr. Lulu said, you should ask them, how can you make them feel better? How can you make their day better? Do you know what she told me when she came back? She said, honey, by the 3rd friend, she was feeling so much better.
Yeah.
No medicines.
Right. You got her out there, and you, in some way, she's fulfilling her purpose without knowing. Wow, that's very interesting.
Now one of the girls wants to start like this youth group thing, because I told her, I said, you need to talk about your depression, talk about your struggles. She's like, I said, I challenge you to talk about it to the first person you see when you go to your Christian camp thing that we're going to go. She could not wait to come back and tell me. She said, Dr. Lulu, oh my God. I said, what? She said, I talked to so-and-so and she said she has the same thing. And I was like, really? So now you see, so now they're connected. And then she said, I said, no, you need to tell other people. This kind of knowledge is not to be kept. You need to make a difference in somebody else's life. Now she wants to write a book. I mean, so the point is, when you just give them something else to focus on. I'm not discrediting that if my child dies, I'm going to be depressed. Yes, because I lost my child. But an antidepressant will not bring my child back. What I need for you to do is tell me that, well, your son has died. It's very likely that he has fulfilled his purpose on earth. That's why he was called back. 1. 2, depending on what killed him, it may be something that maybe I have 2 other kids. Well, thank God it didn't affect those 2 kids. Find a way around it. Don't just say, oh, yeah, here, let's up your dose. The side effect of antidepressants is suicidal ideation.
Absolutely. You are nailing it. I mean, even we're looking in the news now, we're looking up seeing celebrities that are trying to commit suicide. I don't know if you read last week, Miss Taylor Braxton.
I sure did.
And I thought about you. That's why I wanted to do this segment with you, because I wanted you to help encourage people who may be on the deep end, who feel like they've lost it all, who feel like they can't recoup or redeem themselves. This has been a rocky year for everyone. 2020 has been it's been a ride.
I want my money back for 2020. So here's the thing. So, I mean, I will encourage you, but I always say, like any coach, any basketball coach, you pick one and then pick a basketball player. You pick anyone. I don't care, Steph Curry, Shaquille O'Neal, whoever. They need their coaches, 1. 2, the coach does not play the game. You have to play the game. You must play your role. And my patients, I tell them, I say, I'm not going to do it for you. I will say, look, you look like you play center forward. I think you make good defense, or you whatever jump shot. You are good for this, you're good for that. But you have to play and deliver. And so if you're not motivated to deliver, guess what happens? The team fails. And I'm part of the team. And so I tell the parents, I say, you are all part of the team. And if you guys don't play your roles, the team is going to fail. And when the team fails, the coach is part of the team.
Right.
But so I can only encourage you so much as you also want to be encouraged. Because the loudest voice you hear is your own voice, not Dr. Lulu's voice.
Yep. Very true.
In my 6 weeks controlling your anxiety program, that's what I teach. We go into a deep dive. We take it weekly. The first week is, why are you here? That's the first week, right? We talk about what happened. When did you first start feeling this way?
You know, there's a lot of people who never ask that question.
Boom. One of my patients, you know what she said to me? She said she went back to kindergarten when her mom took her to kindergarten for the first time and left her, and she got anxious. And she's 16 today. She never has had anybody ask her what happened, and let's go back there and free that child.
Wow.
So you can be all you can be, right? So, yeah, folks are depressed and sad. They don't even know why. I get depressed, I get sad, I cry in a minute. But I always tell myself, listen, 3 A's or 3 R's, whichever one you like. The first R is recognize the thoughts. What's that? Right. Recognize it. Make eye contact. Ask what? Come on in. Let's talk. Yeah. The second thing you want to do is, I forget. They're similar. The first one is recognize. The second thing is reach out. I think that's the third one. And then the second one is resolve. But either way, I think it's recognize, resolve, and reach out. So resolve that when that thought comes in, tell the thought, say, what's she saying? I'm not good enough. I'm not good enough for what? Like, for instance, I'm just gonna say, I don't know. I'm just gonna put out something out there. You lost, okay? Then your voice says, not good enough. You were horrible anyway. Were you really horrible? People don't quit their job. They quit the environment, the toxic environment, because you know what? The next job you're gonna get, you're gonna be doing the same thing. Yeah. So you have to tell yourself, say, wait, why did I lose my job? What actually happened? Once you analyze the root cause, it's easy to say, you know what, maybe I lost my job. You know how they say